Hello, beautiful mama. Welcome to Navigating Motherhood with Confidence. I'm Dr. Sarah Hardy, naturopathic doctor, mother, and creator of VitalityNaturalHealth.ca. This program supports informed, intuitive mothering by providing reliable information on a variety of family health topics and featuring moms who are nourishing the connection with their inner wisdom and integrating it into real life every day. Today we're chatting about fever, a common reason parents seek medical advice. The myths about fever contribute to fear and worry when a child's temperature rises. Let's dispel these myths and explore some options for fever management.
Hello, beautiful mama. It's Dr. Sarah here. We're coming into cold and flu season here in Canada, and with cold and flu comes fever. And as a naturopathic doctor, even with all of the knowledge that I have about fever and how the immune system works, as a mom, I have been through this process with my little one, and I know how much of a challenge it can be, especially when they're feeling sick. My hope is that today's episode will give you some additional tools for your cold and flu toolkit and help you move through this season with a little bit more ease. Let's head on over to the computer and get started.
Fever is one of the most common reasons parents seek medical advice, and it's a frequent cause of fear and worry. By becoming more informed about why the body produces fever and some effective ways to manage it, you alleviate fear and empower yourself to confidently take action. In this video, we'll define fever, take a closer look at what happens in the body during fever, ask whether fever can do harm, understand when to seek medical advice, and explore tools you can use at home to manage fever. Fever, an increase in the body's temperature, has a variety of possible causes. One of the most common causes is infection, and that's where our discussion will focus. Specifically, fever is defined as a body temperature greater than 99.4 degrees Fahrenheit or 37.4 degrees Celsius. When the fever is caused by infection, the most optimal infection-fighting temperature is 102 to 103 degrees Fahrenheit or 38.8 to 39.4 degrees Celsius. As the temperature rises above these levels, there is higher risk of dehydration, and it is an indication of more serious illness. Fever is a key immune response, part of the body's natural defense system, whose primary job is to destroy invaders. We are born with some of our first and second lines of defense and gradually develop our third line of defense over our lifetime. The first line of defense includes both physical barriers, like skin and mucous membranes, and chemical barriers, like digestive juices and tears, that prevent entry of invaders into the body. Our second line of defense includes white blood cells, whose job it is to identify invaders and destroy them. And our third line of defense creates antibodies, a memory system that enhances the second line of defense. Fever, as I said, is a key immune response, and it optimizes the second and third lines of defense. Let's take a closer look at how this happens. When an invader gains access through our physical and chemical barriers and enters the body, it releases a chemical that is recognized by the immune system. The immune system then sends a signal to the brain to turn up the heat. The brain responds by telling the rest of the body that it's just too cold. With shivering and an increased metabolism, we generate heat, and with constricting blood vessels on the body's surface and producing goosebumps, we conserve heat, both which produce fever. In the meantime, immune cells also communicate with other systems in the body. Signals to the brain say it's time to sleep to conserve energy for our internal defenses. Signals to the liver ask it to produce special proteins to help the immune system and to protect the liver from damage. Signals to our metabolism creates a shift from using carbohydrates as a source of energy to using fats and proteins as sources of energy. Signals to our muscles cause some of the tissue to be broken down as raw materials for defense, repair, and energy supplies. This produces the characteristic muscle aches that are often experienced with fever and that often encourage us to continue resting to conserve more energy. Digestion is a high energy demanding process, so signals to the digestive system ask it to slow down and to reduce our appetite so that the body's energy is focused on healing. And with the increase in body temperature, the immune system responds as well through a variety of processes that improve detection and killing of invaders and inhibit bacterial growth. The bottom line, fever is a part of the healing wisdom that nature has provided us. A moderate fever is a friend, just not one you want to spend a lot of time with. The biggest risk of harm from fever lies in the potential for dehydration and electrolyte imbalance in the body. As our body temperature rises, we sweat to keep cool. Sweating causes salt and water loss that is further compounded if the illness causing the fever is also causing vomiting, diarrhea, or both. Signs of dehydration to watch for include no more sweating, increased thirst, and lethargy. Dehydration is a definite indication to seek medical attention, especially if the little one is not drinking fluids or cannot hold down fluids. A common fear of fever is related to the potential for brain damage. It's important for you to know that no record exists of a single case of brain damage due to fever with infection, except when there is infection of the brain itself. Another common fear related to fever is febrile or fever-related seizures. These happen in about 3% of children with an infection-related fever. The experience is certainly frightening, but once it passes, children continue to develop normally. There are no records of febrile seizures causing brain damage. Seizures lasting longer than 15 minutes do increase the risk of brain damage. However, febrile seizures are usually much shorter in length. It's also important to know that febrile seizures do not increase your child's risk of epilepsy. The chance of having a febrile seizure increase with dehydration, and they are most common in children aged 3 months to 5 years. There's an increased risk of recurrence of febrile seizures in kids who've already had one, when the first seizure happened at a younger age, and when there's a family history of febrile seizures. If your child has a febrile seizure, do your very best to remain calm. Take a few deep breaths and remind yourself that it won't last long. If you can, time the length of the seizure so you can tell the doctor, and if it lasts longer than 5 minutes, call 911 or the relevant emergency services number in your area. Make sure the little one's immediate environment is safe, removing objects that may be hit. And remember to avoid restraining your child. When the febrile seizure is over, comfort and reassure your child and take a few more deep breaths yourself. It's important to call your medical doctor for an immediate appointment so your child's condition can be fully assessed. Generally, when it comes to managing a fever, it's important to treat the child, not the fever. An individualized approach to treatment is best, as the height of the fever doesn't always dictate the severity of illness. When your child has a fever, review this observation checklist. Is your child drinking fluids well? Is he or she urinating at least once every 8 hours? Ideally, every 3 to 4 hours, or wetting 6 to 8 diapers daily? Are you able to console him? Is she playing normally? Is he alert and smiling at you? Is her skin color normal? Does he look well when his temperature comes down? There are some instances when it's important to seek medical advice from your naturopathic doctor, from your local healthcare line. Here in Nova Scotia, it's 811, from your medical doctor, or at the local emergency department. These include any time you are unsure of what to do next, when an infant less than 3 months old has a rectal or ear temperature of 100.4 degrees Fahrenheit or higher, when an older infant or child has a temperature higher than 104 degrees Fahrenheit, and when a child has a fever less than 104 degrees Fahrenheit and refuses fluids or is too ill to drink, has persistent diarrhea or repeated vomiting, has any signs of dehydration, has a specific health complaint that has not been previously diagnosed or has worsened, has had a persistent fever, or has had recurrent fever. And it's important to seek emergency medical care when a child has a fever plus any of the other symptoms on this list: inconsolable crying for several hours, extreme irritability, lethargy and difficulty waking, rash or purple spots that look like bruises on the skin that weren't there before the child got sick, blue lips, tongue, or nails, an infant soft spot on the head that seems to be bulging outward, a stiff neck, severe headache, limpness and refusal to move, difficulty breathing that does not get better after the nose is cleared, leaning forward and drooling, and of course, seizure. A common intervention for childhood fever is a fever-reducing medication like Tylenol, Advil, or Motrin. It's important for you to know that there are both ups and downs to giving a child these medicines. The biggest ups, they often help a child feel better quickly, and the child may be more likely to drink more fluids, nibble foods, and sleep. The downside, these medications can mask other important symptoms, and some studies show that they actually suppress the immune system and prolong illness. And when given to children before or after vaccinations, they've been shown to reduce the body's immune response to the vaccination, thereby reducing the vaccine's protective value. It's also important to know that use of these medications comes with risks. For Tylenol, the most serious is liver toxicity. This is more likely in children under the age of 2, those at risk of dehydration, those receiving repeated doses of the medicine, and when Tylenol is used in combination with ibuprofen. In research studies, use of Tylenol has not been shown to reduce the duration of fever or improve the mood, comfort, appetite, or fluid intake any more than physical methods. And it has not been shown to reduce the incidence of febrile seizures. For ibuprofen, also known as Advil or Motrin, the biggest challenges are of digestive irritation and upset, and kidney toxicity. The risks of these occurring increase when a child is at risk of dehydration, when he or she receives repeated doses, in infants under 6 months of age, and when used in combination with Tylenol. There is also no evidence that ibuprofen reduces the incidence of febrile convulsions. There are many other options for managing fever beyond the usual fever-reducing medications. The overall goals of these options are to boost the immune system, improve circulation of immune factors, prevent dehydration, and help the body use the fever for fighting infection. We're going to take a look at a variety of treatment options for you to consider at home. For food, let your child determine when and how much he eats. It's best to avoid forcing a child to eat when their body says no. Remember, sugar delays the natural immune response, so easily digestible whole foods are best. Try homemade soups, fresh smoothies, and popsicles made in BPA-free popsicle molds. It's very important for children with fever to have lots to drink. They may not feel thirsty, but it's an important step in preventing dehydration. Children who are nursing can be offered the breast or expressed breast milk more often. For those not nursing, offer small, frequent sips of fluids, avoiding drinks containing caffeine, as well as sports drinks, as they are not designed for children. Healthy options include homemade soup broth, coconut water, and herbal teas such as peppermint, ginger, and chamomile. Peppermint tea's cooling effects reduce fever, but should be avoided in infants and children diagnosed with reflux, as it can make reflux worse. Ginger tea's warming effects decreases chills and promotes sweating, and chamomile tea calms and relaxes an uncomfortable and restless child. Children over 2 years of age can drink a half a cup of tea 4 times daily. These teas can also be mixed with smoothies or into homemade popsicles. For breastfeeding children, mom can drink 1 cup of tea up to 4 times daily, and some of the tea's benefits will be passed in the breast milk. For clothing, always remember to follow your child's cues. Little ones who are pale, shivering, and chilled can be bundled in breathable fabric so sweat can evaporate. If the fever is low, consider dressing your child snugly and giving warm liquids to help fever production. And if he or she is sweating and complains of heat, focus on light clothes and let the covers come off. Water is a wonderful, readily accessible therapeutic that has many uses during fever. When considering hydrotherapy, or the therapeutic use of water, be sure to have a thermometer handy so temperature can be measured regularly during treatment. End the treatment about 1.5 degrees Fahrenheit before the goal temperature and let it coast the rest of the way. And during treatments to reduce fever, always stop the treatment if your child starts shivering. A lukewarm bath, tepid sponge bath, or cold friction rub can be used to reduce a high fever when there is little or no sweating. A lukewarm bath decreases body temperature by conduction. A tepid sponge bath does so by conduction and evaporation. A cold friction rub brings blood to the surface, cooling the blood and reducing body temperature. Cold water on its own produces shivering and increases fever, so the key factor here is the friction provided when you rub your child's skin with the cloth. For a child with a low-grade fever and infection, consider using hydrotherapy to increase body temperature to optimal bug-killing conditions. A comfortably hot bath increases blood circulation to the skin and warms the blood to increase body temperature. Remember to monitor your child's temperature, discontinuing treatment at 101 degrees Fahrenheit and letting it coast to the 102 to 103 degree Fahrenheit optimal bug-killing conditions. Acupressure is another option for helping to reduce fever. Pressure on the point you see here, found on the back of the hand between the thumb and first finger, clears heat, promotes calm, and reduces aches. Homeopathy is a wonderful treatment modality for children. These specially prepared remedies are flexible, gentle, and safe, and promote the self-healing processes in the body. It's best to have a consultation with your naturopathic doctor or homeopath to determine the best remedy for your child, as recommendations are more individualized and based on all of your child's symptoms and responses. Beyond fever management, one of the very best tools you have is illness prevention. Promote the development of a healthy immune system for everyone in the family with adequate, restful sleep, fun and play, healthy nutrition, digestion, and elimination, and avoiding fever-reducing medications when they are unnecessary. And always remember, fever is a natural, supportive friend for enhancing the immune system response against invaders. I invite you now to take a few minutes, settle comfortably into your chair, close your eyes, and take a few more deep, healthy breaths. As you take these breaths, allow all of the information you have learned through this video to soak in. And, turning your awareness towards your heart, ask that deeper wisdom inside when it comes to fever management and all of the tools we've discussed today. What feels best for your family? As with any parenting decision, using information from reliable sources along with your own inner wisdom allows you to make confident, empowered decisions about your health, your child's health, and your approach to life.
Thank you for joining us today, beautiful mama. For additional resources to nourish the connection with your inner wisdom, visit vitalitynaturalhealth.ca and sign up for the Navigating Motherhood with Confidence free 21-day program. It guides you through a variety of practices and the ways you can integrate them into your life every day. With love, until next time.